Hello, everybody. Welcome to the show. I'm very happy to bring you Harmony United Psychiatric Care. We have Dr. Mohammed joining us today, and everybody knows at this point how much of an advocate I am for mental health. So to know that we have a new practice opened up right in Clearwater, I'm a very happy camper today. So welcome to the show, Dr. Mohammed.
Thank you so much, Sharon. I really appreciate the opportunity that you allowed me to speak to the Clearwater community.
Yes, and
Um,
beyond.
yes, and beyond, and hopefully this will be helpful for people in need of mental health services to get to know what we do.
Yes.
So I am the founder, CEO, and medical director of Harmony United Psychiatric Care. Um, we are a mental health outpatient treatment center, mental health and substance abuse
Mhm.
treatment center. We, we are a team of dedicated professionals, which includes psychiatrists, psychologists, licensed therapists, psychiatric nurse practitioners, physician assistants, as well as we have a lot of administrative and other staff members. And we are very dedicated and compassionate about what we do. And we try to make a positive difference in the lives of our clients that we take care of.
So, yes, I'm very happy to hear that you are open. So, what I want the audience to know first and foremost is when we talk about advanced practitioners, I've been in the medical industry for 20 plus years now, which
Right.
is hard to believe. I celebrated my
Wow.
48th birthday the other day, so
Oh
I'm
my God.
there. But I'm blessed in the sense that I have hired and really been involved in the different types of staff in the
Hmm.
medical industry. And I don't
Sure.
think a lot of people understand the benefit of having sometimes the advanced practitioners
Hmm.
to marry along with the services the MD or the DO provides. It's
Hmm.
really such a
Hmm.
great extension to
Hmm.
provide more care. And
Hmm.
my best friend is a nurse practitioner, so I'm
Oh
a
wow.
advocate. Yeah,
That's wonderful.
yeah, and I think that it really is such a great compliment to your practice because you've been able,
Mm-hmm.
along with the help of these advanced level practitioners, we don't
Right.
call them mid-level doctor. We've learned our lessons about that too,
Right.
because they are advanced, right? And
Right. Right.
especially gifted to be able to open up all the locations that you've opened. So,
Hmm.
so you have 9 locations. How many do you have now?
We have 9 locations. We had actually total of 10. We
Mhm.
actually closed one recently
Okay.
because we had actually we had two other office locations that are close to the other location. So it was not necessary. So
Mhm.
we closed that down.
Gotcha. So you
Mhm.
just reached Clearwater, but you
Yes.
are in Palm Harbor.
Palm
Tampa.
Harbor, Tampa. We have at Altamont Springs, Claremont, Lake Mary, Lady Lake, Ocala, Gainesville.
Hmm. Wow. Okay,
So
great.
about 9 locations.
So we were talking before I hit record today, because obviously I'm very excited about this conversation. As
Mhm.
somebody who has run a pediatric practice for many years prior to opening this business of mine, I had a very hard time finding really great referral sources for our primary care docs to
Mhm.
the mental health world.
Mhm.
We had our list of few, but there was always this huge waiting list. So there's a few
Right.
things that I love about what you're doing. Number one is that you have all these locations,
Yes.
but you also have telehealth. So
Yes.
why don't you tell the audience about all of
Mhm.
that?
Sure. So, in terms of the advanced practitioners, I wanted to let you know that the advanced practitioners that work in our company, they are specifically trained. They are psychiatrically trained nurse practitioners. So they spend 2 to 3 years doing psychiatry only. So
Mhm.
that way they are very much trained in psychiatry. So that's a good additional point. So they are very qualified in terms of seeing mental health patients.
Sure.
Number two, in terms of coming back to your question about scheduling patients in terms of availability and telehealth, a little bit about our services. So we do medication. Some mental health practices, they do counseling only. And
Hmm.
some mental health practices do just medication management. But in our practice, we are a comprehensive practice. So we certainly do medication management services. We do psychotherapy and counseling services. We can also do testing, that is a neuropsychological testing.
Hmm.
Some locations already have the neuropsychological testing available. Some locations don't, where we are planning on making that available. However, we have an online neurocognitive testing for ADHD that
Great.
can be done at any location.
Mm.
Now, in terms of the telepsychiatry services, so we have opened up recently the telepsychiatry services throughout Florida. It's not just limited to Clearwater. Anyone who wishes to avail our services, they can actually do that via a secure platform as long as they have an access to a computer, tablet, or cell phone.
Hmm.
Can actually seek services from our client, whether it is medication management or psychotherapy and counseling. Um, so all of these services they can avail through the tele platform.
So let's talk about what a huge benefit that is today in 2020 pandemic land.
Absolutely. I mean, considering that, right now, even with, of course, pandemic is certainly a big factor to consider. But even if when the pandemic, say in future, there is no pandemic, but still think about the convenience of being able to connect to your provider via a tele platform. We all know that everyone is busy in their lives right now, and it
Yeah.
is hard to make time to go somewhere just to for a couple of hours to take a break from work. It's sometimes difficult.
Well, let's be
So
real, Doc, too. Not everybody
yes,
wants to go to the psychiatrist's office,
yes,
sit in the waiting room,
privacy,
and
privacy,
feel embarrassed and ashamed. Now,
correct,
there should be no shame, nor should there be any embarrassment in asking for help, right? You and I,
right,
this is an understatement of the year. The
right,
only shame is not doing anything about what you
right,
have going on. But
right,
I know from personal experience, I remember the times when I was going to see the psychiatrist or going to see the therapist,
right,
all in your own head. But when you are anxious, when you are depressed, when you are suffering from addiction,
right,
it's like the noise is so loud about what
right,
is that person thinking about me, and
hmm, right,
just scared, right? And I think
right,
that although the in person is never going away,
right.
it's
But
such a great advantage to have for people.
right. So there is another option available that they can avail the services via tele-platform, and it is way more convenient. So if you're at work, you don't have to spare a few hours or take a half a day off. You can just take 20 minutes break, and
Hmm.
then in 20 minutes, you can see a doctor to get your medications and all that taken care of. So
So
that's very convenient.
I joke all the time that because I shared with you that
Mhm.
I have I'm sober 26 years. Everybody who's been on the show
Wonderful.
knows this. I tell everybody because there's no
That's good.
shame, right? I mean,
Right.
look at me today,
Right. Yeah, you're
businesses, right?
very
Uh,
accomplished. Yeah, they're good
right?
job on that. Yeah.
Thank you. But I want people to know that there's hope, right? And
Right.
really, unless you see it sometimes or unless you hear it, you think that you're the only person, that nobody else goes through this.
Right.
But I
Right.
think that it's such a wonderful addition to our community to have these services available because we
Hmm.
just don't have enough. We
Right.
just don't have enough psychiatrists, psychologists, mental health professionals,
Right.
and addiction specialists. So, do
Mm.
you have certain representatives within your organization that just specifically treat addiction? Tell me a little bit more about that.
Yeah, we have, so we do not do acute detoxification
Okay, good.
from alcohol or opiates. However, we do medication management for their addiction. So there are medications available to prevent cravings for alcohol and other drugs. So we can prescribe those medications. We can also take care of the co-occurring mental health conditions along with the substance abuse, such as depression, bipolar, anxiety.
Mhm.
And along with that, we can also provide counseling, substance abuse counseling. A lot of our therapists are experienced. Several of them do provide substance abuse counseling, which can be done one-on-one.
Mhm.
We do not do group counselings, but we do individual counseling.
That's great. So let's talk about TMS and
Mhm.
TRD.
Right.
Please explain to the audience what those two
Sure.
methods are.
Yes. So treatment-resistant depression. This is a term which is used for to define people. We see on a daily basis a lot of patients suffering from depression. However, despite all our efforts, sometimes there are some patients who typically do not respond to multiple medications.
Mhm.
Ideally, if somebody fails multiple medication trials, antidepressants, then it is called treatment-resistant depression.
Mhm.
Um, the definition of people who would qualify for TMS. TMS is a treatment. When initially the research was conducted, it was recommended that anyone who fails one medication trial, they can get TMS
Mhm.
services. TMS is indicated for them. However, the insurance companies have a separate requirement to get those services covered through insurance. Insurance companies typically require somebody to fail 3 to 4 medications
Mm.
before they can approve. However, if somebody wants to pay out of pocket, if somebody fails, they can do treatment at any stage.
Mhm.
This is basically a treatment that uses magnetic wave to stimulate your nerve cells in the brain to help improve symptoms of depression.
Mhm.
We typically do a brain mapping, and then we locate the spot that is responsible for emotions, which is called dorsolateral prefrontal cortex. And then we actually identify that spot and stimulate that with magnetic wave. The treatment itself is great, a huge amount of success with this treatment. And the good thing is that with this treatment, you don't really have to be on medication.
Mm.
That's one advantage. Number two, there is no
Big
long,
advantage, Doc.
yes, there is no long-term side effect. So you have nothing to lose. So there is actually zero, almost negligible long-term side effects. The short-term side effects are most commonly headache, insomnia, which typically people overcome within a couple of days, and not everyone experiences that.
Mhm.
And then one other side effect that may occur is seizures. That is one in approximately 30,000 people may experience seizure while they're getting this treatment, but that also this is not long-term. You stop the treatment, it goes away. And then we take a lot of precaution previously just to make sure that this does not occur.
Right.
So other than that, this treatment is well tolerated, and it's a very good treatment.
All right, everybody. So Doc doesn't know this, but we've done 130 of these interviews
Oh,
and
wow.
pandemic. And when the doorbell rings and the dog starts barking, we pause. And now we're back. We have to do it as real as possible here, Doc, because this is the life that we're living today, right?
Sure. No, I completely understand. Mhm.
So we were talking about TMS and TRD. I just want to make mention before you continue that, I grew up in New York and our company was Eastern Western Medicine. So it was very important for me to be introduced to that. I feel like at such a young age because I'm a firm believer in science and medicine, but I
Mhm.
also believe that there are many options. So I love to hear that you are implementing other services besides just medication, because that has
Yes,
to be spoken about if we're
absolutely.
going to have some real talk here at the Doctor Whisperer.
Absolutely, absolutely. I believe that the treatment is um, um, individualized, and it has to be tailored to what patients need. We definitely do not try to push medication as a primary stay of treatment. However, we tailor that to individual need. If somebody does not need medication, we recommend they just do counseling and psychotherapy. That will be good enough,
Sure. So
sufficient.
somebody, if they wanted to just come for counseling and therapy, your
Mhm.
company would be a good fit for them.
Absolutely. We have several clients who come to us just for counseling. They do not take any medication. Secondly, if somebody is not sure whether they should take medication or they shouldn't, they can just get a consultation with one of our doctors or nurse practitioners, and they can let them know, okay, they can, evaluate them and let them know, okay, your condition can be treated just with psychotherapy. So you can choose either or.
Great. So I'm going to assume that you take
Mhm.
most medical insurance.
Yes, we do take most medical insurances. We do not accept Medicaid,
Mhm.
and I think there are very few other insurances that we do not accept. We accept most commercial insurances. We accept Medicare and most Medicare Advantage programs.
And then, of course, always cash.
Yes, of course. If somebody wants to pay out of pocket, they can certainly do. And our pricing are very affordable. I mean, it's way significantly lower than any other places that they would come across.
Well, also, I mean, I think that we have to have candid conversations today. I don't think many people, if they hear that their insurance isn't accepted, they just automatically would assume it's going to be tremendously expensive.
Right,
And
right,
the best advice I can give for that, and I'm sure you would offer the same, is to call and ask.
right. Yes, absolutely. The good thing about our company is that you can communicate with us via email and via our website. So
Yeah.
we have a form. So a lot of times, I know some people, they have previous experiences with other medical offices that they call. Okay, somebody's not picking up. They're leaving voice message, and the other people are calling. No, we are good in terms of communication. Um, you don't really have to call us. You just uh, if you're on cell phone or computer, just browse our website, and there is a form, a booking appointment form, or contact us page. So you can communicate with us via email, and you will get immediate correspondence, and you can reply to that as per your convenience. Because I know a lot of times people are working, and they can't be talking on the phone, and that it's easier for them to kind of reply to an email. So you can choose to communicate that way.
So are you telling us that you are actually a part of 2020 and
Yes, absolutely.
technology?
Yes.
Wow.
And we are actually taking a lot of steps to streamline a lot of these communications. So in near future, we are trying to implement something that we are going to be communicating with our all of our clients. Of course, when you are a new patient, you will be talking to someone to kind of get to understand a little bit how it's going to work. But from there on, all the communication will be via our website or their patient account or portal. So,
Beautiful. I mean, I think that there's nothing more frustrating for me as a human who loves technology,
mhm.
to try to make an appointment and not have the availability to book online or to have some type of email correspondence because
Email or text,
text. Oh my
yeah.
goodness, glory days.
Yes, absolutely. So we have a lot of clients at this time are communicating with us via email, via text,
Mhm.
and we set them up. And a lot of individuals are working, and they don't have a lot of time to just talk on the phone, and they might
Mhm.
be busy. And that way, they find it very convenient for them.
That's really wonderful.
Mhm.
Well, I'm going to stop this recording and keep talking to you because there's like 10 people that came to my mind that I want to introduce you to,
Sure,
that are in the area that I think you need to know for referral partners, because
sure.
the difficult thing about business of medicine is that we're all very busy and
Right.
there's not a lot of time to connect,
Mhm.
especially when you're running as many locations as you are.
Right.
So I'm happy that you're new to the Clearwater area so we can help
Right.
to amplify your services and let everybody know that you're there, because God knows we need as much mental health
Right.
um, professionals to help us, because
Mhm.
this pandemic extends to the mental health pandemic that we're experiencing, and it's only going to
Mhm.
get worse, but it could get
Absolutely.
better.
I would really appreciate that. Certainly, I mean, I make myself available, but for certain kind of activities that is required of me being in my position to help the administrative part of the practice. So I can certainly make time for coordination, meeting with new people. So I'm
Good.
pretty open to that.
Good. There's lots of people that need to meet you. Well, thank you
Sure.
so much for joining me today.
Thank you so much, Sharon. I really appreciate that.